Well, this week, more than 75,000 healthcare workers could walk off the job in what would be the largest healthcare strike in U.S. history. Unionized healthcare workers, including nurses and EMTs, are negotiating new contracts with Kaiser Permanente. Their original contract ended Saturday night. Tori Mason tracking the impacts this could have on you if a deal is not reached and employees turn to the picket lines. Tori.
Well, the hope is that we'll never know the impact of this strike because neither side needs this to happen. We already know that Kaiser says they may need to reschedule non-urgent appointments for patients, but workers say meeting their demands will benefit patients.
I would say frustrating, slightly disappointing at this moment.
Kaiser Permanente and union reps are still at the bargaining table. If they don't come to an agreement soon, more than 75,000 healthcare workers are prepared to strike.
It's real slap in the face when we're talking about movement of half percentages when it comes to wage increases.
Stephanie Felix-Soe is president of the SEIU Local 105 union.
We represent members of the coalition across these states that are some of the most expensive cities to live in.
Pay is only part of it. Workers want Kaiser to address the issues behind understaffing and retention, like better hiring practices, guaranteed benefits, and education. In a statement, Kaiser Permanente says, "We will continue to bargain in good faith until we reach a fair and equitable agreement that strengthens our position as a best place to work and ensures that the high-quality care our members expect from us remains affordable and easy to access." Kaiser says they have plans in place to provide high-quality care should a strike occur, but the union says quality has already suffered.
Patients are feeling the impact right now of the Kaiser short staffing crisis.
Kaiser says they're hopeful an agreement will be reached before the strike deadline.
Nobody wants us to get to that point, but folks have really maintained that they're going to do what they need to do, everything necessary to make sure that patients are safe.
Now, if a strike occurs, Kaiser would continue to offer care, but they haven't said exactly how they plan to keep things running. This strike would be 3 days. If they still can't reach an agreement after that, the union is committed to coming back to the bargaining table next month. We're live in Lakewood. Tori Mason covering Colorado First.
Yeah, we all hope they can work things out. Tori, thank you.